Staff across the country are courageously working the front lines week after week, caring for the sickest of the COVID-19 patients.
A suburban nurse actually volunteered to help those patients. A major change for sure from her regular duties taking care of expected moms and newborn babies at Northwestern Medicine Central DuPage Hospital in Winfield. Registered nurse Ashley Holzman joins us now to talk about her experiences so far. Ashley, thank you for being with us.
Thanks for having me.
Yeah, so I'm curious, they were asking for volunteers to cross-train. You didn't have to do this, but you wanted to.
Yeah, it kind of became, it was an email to us that said that, eventually in time it might become a mandatory thing if they didn't have enough people that stepped up. And I don't have a husband or family, so it's just me and my dog. I decided that I wanted to just, go in and do the right thing and volunteer to help out. Kind of like face this disease head on instead of just like fearing it from the distance.
Well, Ashley, I know that you're, as we mentioned, are used to dealing with expectant mothers, but this is a whole different ball game, isn't it?
Whole different ball game. And I say to everybody, I'm like, you're ready to have a baby? I can do it in the grocery store if you need to. It's just this is like very different for me. But the teamwork there, they all know that, and all the nurses that I work with in the ICU are just completely outstanding, and we do a lot of communicating through the window and putting our call lights on when we need supplies and stuff. And I feel like, especially when I put my call light on, I get like 3 or 4 people that run in because they are like, oh my God, it's Ashley. Who knows what she needs?
Well, you're used to, though, just walking into a patient's room, right? This has been very different from you on a number of levels.
Yeah, so I actually don't fit the N95 masks that everybody wears. I always had leaks in them when we did our fit testing. So I have to wear the PAPR, which is like that big hood that you saw in the pictures. So it is a process to get, gowned and put your donning and doffing before you are in and out of rooms. So it definitely takes a lot of time to get in there when there is something that's going on that you need to address right away.
We've been hearing from a couple of folks who are on the front line as yourself, but it's nice to hear the different perspectives. What is a day like for you? How difficult is this?
Honestly, because it is not my typical thing, and a lot of us, are dealing with this very new, and you're learning stuff every single time you come to work. There's new updates and new ways that we're doing things. I mean, it's just kind of like working as a team. Everybody helps each other out. And it is busy. You're kind of nonstop the whole night, especially because when you go into a room, you went through the whole bit of putting all that stuff on. Like, you're going to probably spend an hour in there doing all the things that you need to do. And you'll wait by the window for people to bring you things that you need as you come across them. And it's definitely just a lot of critical thinking.
You seem like you have a great attitude. It's awfully nice to see, Ashley. I'm curious, does it help that you're used to normally helping people celebrate the creation of a life? Now you're helping people who are fighting for their life.
Yeah, I have always been very optimistic, and I feel like that gets the rest of the attitude on the unit kind of conveys the same thing. When you have a lot of negativity, it seems to bring a lot of people down. So I go to work with a smiling face all the time and just try to approach it as best as I can. And honestly, I feel like it helps the patients, even though a lot of them are sedated and can't necessarily communicate with us. I do still talk to them as if they're awake and, alert. And I think hearing these stories that they come out of sedation and they say, those days I heard you talking to me. It's like, well, that's why I do that.
Wow.
I feel like it makes a difference.
Have you ever been afraid of catching the virus yourself?
Not personally. I think because I know I'm, younger and healthy, and I just feel like I'm hoping I could battle it good. And I feel like if I feared it every single day, I would never be able to go to work. So for me, it's just, I have to just kind of face it, and whatever happens, happens. And we are seeing it in a lot younger population now than we were before. So I think that's kind of scary. But like I said, I'm taking my airborne every day and my vitamins and trying to get my sleep and eat healthy and doing the best I can.
All right. Well, Ashley Holzman, we are so grateful for your time and so nice to talk with you. And for all of those you're helping who can't respond, I think we'd like to say it for all of them and everyone watching too. Thank you very much for all that you're doing.
Thank you very much.
Be safe and be well.
Thank you. You guys too.
Thank you.